Welcome everyone to Diversity, Equity, Inclusion, and Belonging with CLAS. And CLAS stands for Culturally and Linguistically Appropriate Services. And we'll speak to that in depth today. This training is brought to you by the Northeast Caribbean Addiction Technology Transfer Center. And of course, my name is Diane Padilla. So I am going through some of the logistics before I go to ask you questions. We got to go through this disclaimer. It's just a way of letting you know that we are funded by SAMHSA. But it is our responsibility to make sure that what we give you and what we bring to you for to support you in your credentialing, and so you can get information and you can get the current knowledge and current, expert information and skill sets. It's also you can continue keeping your licenses and your certifications, so you can keep doing the work that you're doing. And so that's part of our job. We bring that to you. And so SAMHSA does not check absolutely everything, but we happen to have a really nice reputation of being able to cite our sources and make sure that everything is coming from the research and from practice and best practices in the field. So, and the reason the technology transfer centers even exist in the first place is to actually provide you that type of support. And we're going to talk about workforce support. And so I always start with people. First, words have power, language matters. So I'm going to get off my slide for a second and ask you folks, why do I use that slide? And I know some of you folks have been to a couple of the trainings I've done before, so I'm kind of curious. Whenever you see anything referencing language matters, what is behind that? And please just raise your hands, because I know there's a nice little amount of folks here.
What I can remember about it is that, so due to stigma, for example, there are certain statements that somebody can make, due to stigma or that is attached to those words, that will prevent somebody or that can create a barrier for somebody to, seek treatment.
Thank you. And it's nice to see you. Thank you for starting us off. The stigma has been a very constantly identified factor for folks not seeking care. It's not just substance use treatment, it's mental health, it's even recovery and prevention support services. And so stigma has played a huge part in that. And we've gotten it straight from the sources. It's not just that the experts got together and kind of came up with an educated opinion. They actually went into the communities, and the community members have informed the whole idea about stigma and how language can change. So here's the thing, you folks have been working for a long time, for whatever time, and have been educated and trained on using certain terminology. And that was appropriate. But now we've learned different. And so we evolve from where we are, just like you as a professional evolve your skill sets and your knowledge base, and you grow in your capacity. Part of that is understanding that now we understand that the language we used to use before is more stigmatic for folks. Sometimes this language can seem very judgmental. And so instead of being empowering, it's disempowering to folks, and clients are not as motivated. And this goes for folks who may consider seeking services, and including the folks that we already have in services, and the idea of retaining them, but actually trying to help them understand that we want to walk with them and support them in their wellness process. And so our language sometimes reflects what we know, how we define it, but not necessarily how the communities define it. And so it can be has negative connotations. So we are trying to be mindful of that. And something that my colleagues and I do here, that when we do present, we try to kind of practice what we preach. So we try to change the language and encourage you to do the same thing, because all your funding sources are actually requesting that you do the same. And the whole idea is to be even, just for folks not to internalize that the allies that we can be are actually, not allies. We want to make sure that we support them and they know it. And so that's part of it. So part of it's in language. Sometimes, and sometimes what we forget is that what we say can reinforce what we think, and what we think is reflected in language. So if we commit to using more evolved language, more recovery-oriented language, with more empowering language, that can also reinforce our thinking and keep that cycle going. So that's a great point to start. And for folks who don't know me, because I forgot a slide, I didn't say it, I didn't have a slide on myself and my colleagues. I am a research project manager at the Northeast Caribbean Addiction Technology Transfer Center. I also work for the Prevention Technology Transfer Center, and sometimes I do work for the Opioid Response Network. And I provide a lot of different trainings, just like a couple of my colleagues do. We just do a lot of different trainings. I also provide a lot of technical assistance and implementation support around screening, brief intervention, referral treatment. And I also do a lot of the equity and inclusion related topics. I've been doing that since I got into the field, since I got out of direct services and got into research and training. And so it kind of just makes sense because I like to try to bring what the best practices or the innovative practices are that can help you do the work that you're doing and just maybe make it slightly easier for you, but be even more tailored for the community members that you're providing services to. And this goes for anybody, because when we think about culture, I think everybody has their own perspectives of who they are. But we also know that there are certain communities that are more marginalized than others. So we're going to use a broader scope in terms of how we define this and how we go forward. And it's interesting because in the field, things have changed a lot, especially since the pandemic. And that's going to be part of the discussion today. So I may be able to share some things now and then of my own experience, but I'd rather, if you're okay with that, I'd rather hear from you folks. I am hoping that everybody stays on and I hope you use electronic hands. That way, everybody's voice is heard. That way, we can all hear each other out because there is no right or wrong answers here, but it's really our experience that we want to bring here. And I would encourage you to bring, what's going on with your setting or what you've been able to do successfully so the rest of us can learn from that as well. The goals today include, all right, so we're going to go over the nationally enhanced culturally and linguistically appropriate services standards. The idea here is to understand what they are, to kind of just do an overview and just look at opportunities to be able to increase equitable and inclusive services for diverse communities, racial, ethnic, and also gender diverse communities, as well as the opportunities that it presents to be able to enhance the atmosphere that we work in, the work culture, to be more supportive and in terms of diversity and inclusivity within staff. And there's going to be more to that. Let's begin here. And I thought it was really important to understand, we do a lot of work, or let me just say specifically, because I'm not doing direct services anymore. I work with organizations on different levels, but you folks are doing a lot of direct services with the communities. And so we're going to look at the landscape, but we're going to include you in that landscape. And so part of the reason why this has a double lens, because the opportunities are there, it's not just how we can build equity within our organizations to be more effective with the communities we serve, but also with you folks. And some of the more recent data is showing things like the overload that you folks are experiencing. So the demand for behavioral health has increased substantially. Since the pandemic, there has been a 78% increase across the country in terms of demand for the different services that you folks provide. And so that's like, so 3/4 of different organizations have said that in the past 3 months, the increase has been substantial. And so also like 97% of organizations, or that's just about everyone, have had a hard time recruiting employees. And then there's almost an 80% of them, a good majority of them, that actually have a hard time recruiting anyone at all. A lot of times I work with agencies where we are waiting for the new hires to come in so we can train them so they can have some baseline skill sets so they can, follow through on whatever the funding grant is requiring. And a lot of organizations, it's taken them months to get folks into position. So hiring practices and retaining employees has been extremely difficult. And so that puts an extra pressure on guess what? On you folks who are still who are working there. Because if we don't have if we have positions open and we are not able to fill them in, guess who's going to take care of all that increasing workload? 3 in 5 member organizations say their patient wait list has grown just over the past 3 months. And actually in the 3 months since February 2021. And when asked about short-term policies to meet the increased needs, so agencies are being creative and resourceful in terms of being able to trying to hire differently. And we're going to talk about that here, but how to hire differently. They're trying to, there's a benefit to the pandemic in terms of seeing how telehealth was, how feasible it is for some community members to be able to provide services at different, depending on the level of need. So it's no longer thought about as an opportunity for rural areas, as in the urban areas too, where there's an overwhelming amount of folks who do need care. And so they're thinking about different things that they can do. And this all essentially is kind of creating an atmosphere that's really heavy with the work and with the stress. And this is kind of what we're getting from folks like, like you professionals who work in organizations who are reporting this out. So I wanted to include this here because I don't want to talk just about the communities we're serving. And so when we're thinking about like a topic like this, the culturally and linguistically appropriate services standards, I am curious to know how many folks have heard of CLAS standards before. So some folks have heard it. Okay. Yeah. Samantha, would you like, oh, you just raising your hand? Okay. So let me ask you something. What, before I even go even deeper, what are you hoping this can help you with? This training, I mean, can help you with? You can either raise your hand or put it in the chat. Kimberly, good morning.
Good morning. Kimberly Yule from New Jersey. We actually are utilizing the CLAS standards. It's a requirement from our funding source. We created and expanded upon our cultural competency plan last year. So I joined this training in hopes of trying to gain some additional ideas in terms of things that we can enhance with our current plan that we have, because we're looking to make some additions and edits to it this year.
Oh, fantastic. I would like to say that you're in the right place because we do have some ideas to offer. And hopefully, and that's since you mentioned that, for everyone, I would just want to say that some of these ideas can trigger your own ideas. And then you can go back with your colleagues and kind of figure out, what's feasible, what isn't. And some ideas, some of the things that are suggested here can lead to other outcomes, maybe something completely different that just gets triggered here. And that's what I'm hoping that would happen. You folks got some handouts. And these are tools that I'm going to refer to here. You may or may not want to use them, you can. When I do this in person, I tend to have folks kind of use the checklist to note some of those ideas every time we go to a certain portion of the content. So that might be a good thing for you to do. Again, that can trigger other ideas, not necessarily exactly what we're talking about here. Plus, guess who else has ideas? So Kimberly can offer a lot of what they're doing, and all of you can also offer your own ideas about what comes up for you and what you think might be feasible in your setting. And I also want to respect the autonomy of every setting because everything doesn't look necessarily the same, but conceptually we can apply a lot of the same strategies. All right, so great. So so let me go back to my slides, and I'm going to ask you folks to consider something else. What do we mean when we talk about diversity, equity, and inclusion? How do you understand that? And this is not necessarily a no-brainer. It seems like different people have different understandings of what that is. What comes up for you when you think about diversity, equity, and inclusion? Let's say specifically with your organization. Okay, equal treatment. Okay. Leslie, good morning.
Hi, good morning. This is Leslie also from New Jersey. I think when I think of diversity, equity, and inclusion, I think that a lot of the conversation about equity is confusing or confused by people because equity, people think of equity as equal, and it's not exactly just equal. It's something different than that.
I agree. And so equity really is something tailored to the community or tailored to the person. Do they have maybe equal access to services, maybe equal or opportunities? But it would look differently depending on the capacity of the individual or the community. And so that makes sense. And that's why we use equity is supposed to equal, even though equal is kind of like the foundational, principle there, but it's not exact. If we're going to go back and forth with the words, we're gonna get caught up and get crazy with this. But in terms of diversity, equity, and inclusion, sometimes we see those pictures, right? That kind of have that seem to reflect which one is which. So I tend to think of diversity like just encouraging the differences in genders and representation and ethnic racial backgrounds, age groups, and so on and so on. So that's encouraging and celebrating that. And that's what I feel like diversity is. And you folks can tell me what you feel about it. And I think about equity, like Leslie first started us off, it's like equity can look different for each group or each person, because it goes according to their capacities and what their needs are, and do they have the access to opportunities and resources like everyone else does. When I think of inclusion, and I think about, so let me see if I can give you a picture of what I picture, and I probably should work on an image on this. And I thought about how you invite everybody to a table to eat at a restaurant, everybody's at the same table. Everybody's not from one culture, everybody's diverse. The whole group have this diverse representation there, and that's great. And equity is nice because equity, that everyone is sitting at the table instead of separate tables with their own group, right? What I like about inclusion is not just that you can sit at a table, it's that you can actually ask and eat and order and eat what you want, as opposed to, what is dictated to you. In other words, it's good to inclusivity has to do with not just acknowledging or recognizing that representation may be present, but it's actually including their perspectives, integrating their respecting their beliefs and integrating that in practice. And so we're going to look at how the CLAS standards give us an opportunity to look in the organization from different ways. We're also going to look at it two ways. How do we use that to improve on what we're doing with the community? And maybe some of the things that you find here, you might already be doing. And then how can we use those same concepts to work internally, to work with, within the organization? How do we do that to ensure that the staff is also celebrated, also being given, being supported the same way we're trying to support our communities? So the way I see, the way I have it here, and this is one of many ways, but this is really from the National Council of Nonprofits. Diversity, equity, and inclusion describes the policies and practices that promote the representation and participation of different groups of individuals. And so those are the different ages, race, ethnicities, and so on, genders, sexual orientations, cultures, all of them within an environment. And so I think the key word here is promote the representation. Actually makes a conscious effort, to be diverse and inclusive in this way. And so when we think of that as a concept towards what we are talking about here, I'm going to think about what we do in our organization when we have diverse communities that we serve. So here's the question for you. Could you share, or has there ever been a time where you had to alter or change the way you usually practice, the way you usually do your work, to provide care or services that were more culturally and linguistically appropriate? Can you share about an opportunity or an experience that you had to do that?
I had to use an interpreter.
Okay, and you don't usually do that? Okay, all right, you had to use an interpreter. Any more to that? Any more to that, or does anybody else want to offer another? Kimberly.
Yes, we've also, we actually found a service because we needed to utilize an interpreter, but we found a service that actually will help translate so that the staff can communicate with the individual better.
Okay, that's great. We're going to talk about the communication and language assistance services and approaches that we can use here too. That's great. Any other experiences where your regular routine, you kind of had to change it up a little bit to be more culturally tailored for an individual? Hi, Diane. Good morning.
Hi, I had to use Google Translate to do a text, a back and forth text with some of the, we adopted a shelter for some of the asylum seekers. And the only way to communicate, because all of them speak Spanish, was to once we connected with them, got phone numbers to tell them about resources that were available. We had to do it via text. And they responded, and then I had to go back into Google Translate and translate it again back and forth. And so that was totally different for me, but I felt empowered to be able to do that and be able to connect to them.
Okay. You know what? In the moment you went and you did that, and you was able to, and they were able to respond to you. That's fantastic that you did that. That's great, and especially on your part. We've got some more information on that. Thank you, Samantha. What experience did you have with that?
Well, I love the way that Diane worded that, because it actually was inspiring in some of our circumstances, because generally we're teaching to classes of about 20 to 40 students in around middle school age. And in some of the areas, we may not be informed beforehand of ESL students. So kind of on the fly, just having to figure out how to connect with those students, that they don't feel excluded from the course, from especially the fun parts of the lesson with middle school students, the parts that really need to engage them. We would really hate for language to be the barrier or the reason why they feel excluded. So that was a huge part of feeling connected with the students that I really found rewarding.
That's great. I think that's fantastic, and we're going to give some more information on that. That's a wonderful thing that at least you folks were able to, like, okay, we need to do something so we can communicate with these folks. I have some information on that, because you have a lot of diversity within every one group. So in terms of language, there's a lot of different dialects too, and there's opportunities to help, communicate with someone according to their dialect. So we're going to talk about that too. I see in the chat box. So I asked the client to translate with his phone. Okay. Have notices and forms written in different languages that represent the demographics. Okay, very good. I'm going to give you an example. Okay, so those are all these different types of nice examples, and a lot of them have to do with language. There was one agency, one of my past career moves, and one agency, my boss tended to bring to me the folks who are more Spanish speaking, because I'm fortunate, I'm pretty blessed that I can speak and read and write in both languages, which is great. And at the time, I kind of was the person to go to if their language was, their first language was Spanish. Now, at that time, I had to do an assessment with this gentleman after the intake was done. And then when we do assessments, we ask some pretty intimate questions at times. Now, I had a gentleman who was Hispanic. When I asked him to identify himself in Spanish, and he said, "Yo soy de la patria," yo soy de Mexico. And so that's where he was from. So he was happy that I was Spanish speaking, but when I started to ask certain questions, he refused to respond. He said, "You're young enough to be my daughter. I am not comfortable, talking to you about this," which made perfect sense. So what we had to do, so on the fly, and excuse the layman terms, but at a drop of a hat, I had to kind of rethink how we're going to do this without trying to lose the client, the potential client. So I spoke to my supervisor at that time. This is some time ago. Spoke to my supervisor and another colleague, and the gentleman did speak English, even though it wasn't his first language, but he just preferred to speak Spanish. But I had a colleague, he was African American, who was willing to work with him and do the assessment. It was successful. And so the cultural connection there wasn't so much the language, was that there were two males, and he was comfortable with a male. And he was, and the gentleman wasn't as old as the gentleman was around 60 some odd years old, and my colleague was a lot younger than that, at least by 10 or 15 years. And it wasn't that connection, it was the gender connection that helped him feel comfortable enough to respond to the questions. So we gathered the data that way. So sometimes making a cultural shift, and when we're listening information, when we're trying to resource match, when we're trying to develop a treatment plan or a service plan, we have to kind of think out of the box. It's not always just because this person is Latina and this community is Latino, that's the best match. It's not always the case. I used to manage a national project for more than 10 years for the National Association for Drug Court Professionals. What we did, we used to instruct on how to be more culturally informed in practice for that type of discipline, right? And I remember that there was a time where we were asked to go to Arkansas. Arkansas was able to, they had already started to book capacity. They had representation of, very small, but they had some representation of the Black professionals, but in a mostly white profession in the treatment courts over there. They had a hard time understanding how to build capacity for the Hispanic groups that were over there. And I use Hispanic, Latino, Latinx interchangeably for the purposes of this training, just so you know. And so what they did, the alternative to incarceration option was never on the table for Hispanics who came into court because the treatment courts didn't have the capacity. So they asked us to come in and help them build capacity. In that process, very similar to some of the things I heard you folks say, I heard one of the practitioners has said, what she did is she got herself a book. She looked at what the community was. It was a Mexican and first generation Chicanos. And so in her community, and there wasn't a lot, it was just a little, the group was kind of growing, but they were starting to see them in their courts. And so she did was get a book with that dialect so she can translate with them. So she can be able to have some kind of communication. She didn't have extensive conversations with them. That was just her initial steps to become more culturally informed. But at least it showed potential defendants or potential participants to be able to see that somebody was trying to communicate with them. And then they started to understand about the language assistance services and how could they bring them in. And we talked about the class standards about how to be able to have hiring practices, to how to recruit, and have that representation within their professional environment. And so when you see things like that, when you hear about things like that, community members, even if you don't have it all kind of together, so to speak, when they see that you're making an effort, you are initiating a rapport. And how essential is that to an alliance? And so that is good representation to the community members. And some of the best ways for us to get clients is usually word of mouth. So when one client feels like they are being supported, they start telling other folks as well. And so sometimes we have to change up, and sometimes we're not always as prepared. And so that's the whole idea about when we think about diversity, equity, inclusion, what it can look like in organizations, who is doing it, and are we meeting the needs of the diverse populations, really speaks to how resourceful we can be, how creative we can be, but how tailored we can be for any given individual that's seeking services. And so let me go back to my slides. So good comments though. So we do know this. We know that historically, the underserved populations have tended to be the folks with racial ethnic communities. They're unemployed. They live under the poverty level, uninsured or underinsured, the non-binary community, people with different types of disabilities. These are the folks that tend to have the highest rates of diseases, infections, and injuries. They tend to be more susceptible to more complicated issues, even accessing services. There is a lack of quality of healthcare for a lot of these folks. Increased exposure to societal marginalization as discrimination. And in the pandemic that we're coming out of, kind of, maybe, I saw something on the news the other day that says we're going into year 4. So I don't know what the experts are saying. But I do know that one of the things that happened during the pandemic, even though it was a horrific epidemic that impacted our communities, impacted our family, impacted us. What was glaringly obvious was the disparities that existed, particularly in communities, underserved communities, and typically there were racial and ethnic communities. And in New York and in the city and in rural areas and in New Jersey and in Connecticut and all across the country, we saw that folks that didn't have, who were income limited, who had a limited English proficiency, who everybody didn't have a phone to do FaceTime. Check that out. You know, technology was the only way we could stay connected. A lot of people didn't have that capacity. You know, things like that. And so we're trying to think a little broadly here about how we can make sure that we are in a better position to address the most needs with the most folks. So here we see here, I always thought that this graph was like so telling. And this was done a few years ago. And so this graph, what it shows is a study that was done by the National Healthcare Quality and Disparities Report. They put a report out every single year. And so what it shows is that some services in some communities got better, same, or they had worse access to care. And so everything in light green shows that it's gotten better. Everything in yellow is it stayed the same. And the same actually has to do with communities who have always had a hard time accessing quality care. And so, and red is that it's gotten worse. And you see right from the first graph to the last, the different communities. And now some of these identities are intersecting because you have people, the poor, people with poor folks, poor communities versus folks who have high income. You see most of that bar is red. They had worse access to care. And in comparison to all the rest, they actually had worse access than anyone else. But then you see the Black versus white community. You see that almost half had worse access to care, almost half had the access to care was the same, was not quality care to begin with. And the Asian versus white, you see Alaskan Natives and versus the white community, the National Hawaiian Pacific Islanders, and versus the white community, you see the same. And Hispanic versus non-Hispanic, you see most of the graph is really worse. And so unfortunately, there are a lot of times that the resources are just that limited for communities of color. And so we do know about social determinants of health. Who knows about social determinants of health that you can speak to it? This is the first time you're hearing this? Memunatu, I don't know if I said your name right. I hope I did. That's a beautiful name.
Yes, you said it right.
Yes, okay, good morning. Yes, what is social determinants of health?
Yes, social determinants of health are issues that impact on an individual's ability to access healthcare. And this could be income, this could be educational background, this could be socioeconomic, this could be so many other factors, even like you said, language or cultural barriers, your ability to access it. If you are poor, you are not going to be able to access healthcare. If you are not educated, it's going to impact on your ability to get healthcare. And if you are from a minority background, it's also from an underserved population, as you said, it all affects you. It's like they always talk about the cycle, it goes round, round, round. Whatever, this is one you have, but it affects all others. But generally just what impacts your ability to get the healthcare, to be able to go get it. That's my understanding.
No, you're spot on. Thank you. Let me kind of give you another perspective on the same thing that Memunatu just said. So we are used to collecting data from each and every client. And we're pretty we're not necessarily surprised in a lot of the demographics that we see a lot of times. But when you think about it, and anybody who might remember sociology and Robert Penner's and his ecological perspective that what influences an individual while they're growing. Well, if you think about like where a family raises, where a person would raise their family, where the kids would raise, where they would live, is it a healthy environment? Is it an unhealthy environment? Is it stable housing? Is it not stable housing? Opportunities, are there opportunities? Is there parks in the area where kids can go, where it encourages, health and wellness? Doesn't encourage us. A lot of areas don't have that. Do we have, in some of these areas where people live, do we have healthy food resources? Or do we have more of those franchises all over the place? Is that easier to get to? Do we have, are there, the educational system? Is the educational system, the quality of the system, is it up to par? Or, okay, so you have an educational system where in some communities you will find certain schools with one school in one building. You go to some areas and you'll find 4 or 5 schools in the same building. So the quality and the delivery of the service gets compromised. And you have, let's see, what are healthcare? Healthcare and community resources. Is healthcare culturally appropriate? Is it linguistically conducive? Does it meet the needs of the community members in these areas? And guess who tends to live in a lot of these areas? And a lot of times it's the folks that come to see us. Not everybody lives before the under the poverty line. We have some hardworking people that need services, need help, and they come to see us. But a lot of times, you know, and we have people who have, you know, we're actually well off, who might need our services from time to time. But very commonly, a lot of our community members struggle with the challenges of not having enough or not having access to. These are the things, these social determinants of health help impact the decision-making process for any given individual. So if there's a limited income, if the income that's coming in and the job that has to be maintained, maybe there's 2 jobs that have to be maintained. Perhaps if they don't show up, maybe they don't get paid, so they have to keep food on the table. So maybe prioritizing that is it's more important than prioritizing them taking themselves to a medical appointment where there's a co-payment. You know, so it impacts decisions. It also increases stress. And a lot of these areas also have been impacted, not just by the pandemic, consistently over time, you know, by a different lack of resources, systemic barriers. And so stress and sometimes trauma is part of it. So imagine the things that might increase the likelihood of some psychiatric disorders or substance use or a correlation of the both and more, maybe even some physical, you know, impact. And so social determinants of health is how we consider, you know, some of the dynamics that might be impacting how people will make decisions. So we are encouraged, and that's what the data, and that's what SAMHSA, and that's what a lot of other entities have been encouraging us to do, is to look at that when we're addressing issues with clients, when we want to match resources, when we want to provide a service or a treatment plan or a program or a particular service that is going to meet a specific need that they're at your agency for. Can we consider the other dynamics that might impact whether or not they're able to access that resource we're giving them? Can we consider all these other dynamics that might impact their ability to stay in a treatment program, to be retained there and not just drop out? So social determinants of health has become such a big deal because we have seen those things that we used to call risk factors and protective factors. We see it from a different lens now, and we see how much it impacts communities. And the community that tends to impact tends to be those communities that bear the biggest burden of disparities. So, because I saw, you know, you saw a lot of communities don't have access to quality care. And we seeing about social determinants of health, how that can impact different communities. We also know that the diversity of this nation is changing consistently. It's not about the pace, but it's about the fact that it's constant. And so this is a projection. Every year, there's a projection about what the population will look like, you know, at a certain time range. And what we've seen is that most of the projections usually get superseded way before the date that is projected to reflect this. And what this is essentially saying is that by 2060, collectively, the diverse groups will represent more than 50% of the nation's population. It's actually expected to be around 60%, between 55 and 60%. And it seems to still be on track for that. And so all the more reason why we have to become more adept at what we're doing and kind of think a little bit more broadly, a little bit more creatively in terms of being able to be in position or be accessible to communities who typically have challenges accessing our services. Any comments, any questions, anything that kind of stands out for you here? Here, the burden of disparities, as I was saying, is usually these historically underserved communities. And so some of the barriers to appropriate care, culturally appropriate care. How many folks that have learned enough about implicit bias where they can see it plays a part in systemic issues and sometimes in our practices? Yes? I only saw 1 or 2 heads nodding. So how many folks agree that or know enough about implicit bias to understand that it plays a part in some of these unsuccessful outcomes? Okay, I couldn't see all the boxes, sorry. Okay, we have other trainings for that. But the reality is we're conditioned to work within the same inequitable systems that have been existing for, over decades or hundreds of years since the colonization days. So, and we're still tasked to work with that, with what we got, to be resourceful for our clients. And we know that we can be conditioned also in certain ways because we get caught up in routines. And sometimes we need to be reminded about certain things. I think that's part of the reason why everybody's credentials requires some kind of cultural competency or culturally responsive training every few years. So when you renew, I think it's part of that thinking. And so, very good. Okay. So some of the other things that we already know: poorly designed systems, the language barriers that you've already started to speak to, which we will talk about more, a little bit more in a few minutes. Poor cross-cultural communication between providers and patients. And we'll talk about that just a little bit more specifically. There's also past experiences that impact the clients that we do access, that we do get in care, that are admitted for our services. And the fear and distrust of their past experiences can also impact their ability to actually adhere to different treatment recommendations or be able to follow through on a service plan for themselves. And a lot of folks still have a really refined stigma discrimination. The Black community, the other community, Asian American communities, not to mention Hispanic, Latinx, and other communities as well. Lack of diversity in behavioral healthcare leadership and workforce representation. Let's talk about that. Representation shouldn't be just frontline staff. You folks, a lot of folks are frontline staff, and that's great. It's just, you should not just be there. You should also be in other levels too. And so that's really important across the board and across the nation, not just in some parts of the agency. Are there any others that you would say also get in the way? Also, is it a barrier to culturally appropriate care?
Good morning. My name is Jasmine Miller. I work with youth under the age of 24. And which I'm so happy to be in this training this morning because I actually have a meeting later with a client who seemed to have had some concerns about our interaction. So I had to sit, write down some things and whatnot, just to see where I could have overstepped boundaries or, just see what it is that I can kind of give my response to. Because we didn't have so many interactions, so I remember them. So when I did hear key, points and whatnot. So needless to say, I've noticed that more or less of educational level and whatnot sometimes does play a part within my line of work. Because, use certain words, it's not to be like, oh, I'm the smart one. And sometimes that's really like a turn off.
It kind of comes back to and correlates back to the social determinants of health, depending on that individual, depending on that community. Sometimes lack of education can be part of how some folks might work with other people, but it also might be a lack of information or lack of knowledge or resources. But sometimes when we interact with other folks, it's an opportunity for us to kind of, when it's a red flag, when they say, oh, what you're doing, thank you for being so candid, for sharing. Because I think when these situations come up, it's an opportunity to say, okay, wait a minute, where can I do better?
I understand. Yeah. That's exactly what happened. And to me now, it's like, I noticed it, but it was just one of those where it's just like, because the client did not come back and say, hey, what you said here was, how I felt about it and whatnot. It was just one of those like, I already bias on this client, like you're the strong one. If you want to say something, you will. But they were reporting to other staff, having conversations with other, clients also about their issues that it is that they had with me. So the moment I was just like, you know what, let me send an email just to, point out some concerns that it is that I've noticed, is when the client went to my the higher up supervisor was like, I need to speak to you about, about Jasmine. And I was just like, huh? I was just going to reach out to you so that me and you can have, so, so now the bias and all of that is starting to kick in, because like, you're trying to, complain about me, you're trying to get me in trouble, because now they're aged out of the program. So now it's one of those where it's like, what are you trying to do now that you can't get services anymore? And why did you decide, so it's one of those, so I'm like trying to erase that and listen into this training and whatnot to see what it is that I can pull basically to use for, within the training, within the meeting today, so that I'm not on defense mode, because I've talked about it and processed it to the point now where it's like, when I get in the meeting, I want to be able to listen, focus, just be able to respond when needed, respond without having, that bias and those feelings and whatnot, like personally attached to it. Because at the end of the day, I'm still like, all right, so after this meeting, whatever's said, and, it's like, what can I do now to give him, resources and things like that? Like, I still want to help. And that was always the thing. So it's like, it's a whole misconstrued, like a, misunderstanding and whatnot. And that part but it's one of those where I just want to walk in and be like, okay, let's get to the bottom line of what, what the overall issue is, so that I can provide you some resources and whatnot after. And it's not, and then I'm like, don't say that, because then it's going to make it seem like you're trying to push them over. You don't want to really hear the whole like 3 years of, concerns and whatnot that was like built up and whatnot. But for me, it's like, thinking professionally and whatnot, and, based off of like policies, time, all of that. It's like, what can I do now that my supervisors, that I've, like in my head, it's like, what that I've been doing, but what do you want me to say in front of her, or what information it is that you want from her to help you moving forward now that you have aged out? Because I know that anxiety and whatnot that comes with that, and especially when it comes to housing and, you don't have that interaction, that immediate access anymore. I'm just trying to
you shared quite a few different perspectives from one situation. That says a lot about what you're seeking to improve in yourself. I would be concerned. Okay, so thank you so much. I would be concerned mostly if I'm supervising folks. I would be more concerned with folks who are always perfect and never have an opportunity. Everything comes out perfect absolutely every time. I would be concerned about that. If you're able to acknowledge, something didn't work out right here. Let me take a look at that. That says a lot. That says a lot. But you're also trying to kind of also work with, so what's the agency saying? It's important to also know what the protocols are, the procedures are, where agencies can help you, clinical supervision can help, and kind of marry that together, which sounds like what you're doing. And we're going to talk about that.
Okay.
That's really kind of the basis of culture humility.
Yeah, that's exactly what it is. It's like, I've taken this training, with you for a couple of years, and there's always, it's, we have those qualifications and what it is that we must take. And like, now that I'm able to kind of put together a experience, and a scenario to it, I always understood it, but now I fully understand, because, as I keep taking these trainings, I'm pulling from, what it is that I can utilize. So that's why
that's
today,
the whole point.
I get to have this kind of like, supervision, outside of another supervision, like, because that's how I take these trainings. I'll take like, trainings, I need a certificate. It's like, I was supervised, or, I had a session meeting and whatnot about X, Y, and Z, so that I can, just so it can help me in this profession, because I want to continue with it. I want to grow and understand. And I definitely did start to look at the ones that I'm like, that I've labeled as the strong ones. I give them one, give them one task, they finish it. If they need anything else, they'll come back to me. Now I just feel like I need to, give a little more feedback, do a little more check-in, and whatnot, not to, overbear them and overwhelm them, but just more or less to, let them know that you don't have to do it all by yourself. It's not something that I expect it is for you to do. but more or less of, being that little birdie in the window, like, hey, I'm here. So I have like bullet points and, things and whatnot. Every time I hear something, I have a sticky note for like, things to write down, things to try to remember and whatnot.
Okay.
So I'm working through it.
Very good. Well, this is what SAMHSA funds us to do, is to provide you all with workforce development support, and application of some of this information is key. It's a lot better than just getting a couple of hours of credits to CEs. That's the whole point we're here. And so we tend to want to give you the concepts. We want to give you an opportunity for application. We're going to give you ideas, and exactly what you're doing is what we're hoping. So thank you for that.
Thank you.
I want to come to I'm going to ask you folks to kind of do me a favor, and in the chat box, or you can raise your hand, but in your chat box, you please feel free to finish this term. Define the term by completing the following statement. Behavioral health equity is blank. What do you define behavioral health equity to be? And then type it in the chat box or raise your hand. Okay, empowerment of the client. Anything else? Anyone else wants to add? Equal access to behavioral health, everyone being able to have quality healthcare. All of that word, quality healthcare. Everybody deserves that access. A uniform but flexible approach to a person's mental health and substance use care. Very cool. Patience and acceptance. All these are great. They're all part of this. Having adequate access to behavioral health services. Very nice. All right, so here's what I'm going to put up. So ensuring that different populations served are provided with equal access to care and service that meet the individuals, care regardless of who they are. And that's a big part of this definition here. So SAMHSA defines behavioral health equity as the right to access quality health care for all populations. But they include in the definition, regardless of individuals' race, ethnicity, gender, socioeconomic status, sexual orientation, or geographical location. The fact that you have to even include all the rest of this is a really big predictor in a lot of our research. We've noticed that quite often, in the surveys and the data collecting initiatives that have been facilitated, that race and ethnicity has been a predictor of poor outcomes. And so this definition is saying that everybody has the right to access quality health care for all populations. And that's the direction that we're coming here. And that's really the groundwork as to how we're moving forward here. So let's talk about culturally responsive services. Don't know if this is a new term for you, but I do want to come back here and just kind of get a general definition of culture. There are so many. There is no one agreed upon definition across the great minds across our country. But culture tends to include integrated patterns of human behavior. That includes thoughts, communications, the way people live, the way people speak, the belief system, their values, their rituals, their customs, how they even interact with one another. Everybody doesn't interact the same way. Whatever role expectations they may have in that culture, the relationships and how they behave in their relationships. And so all of that having to do with any racial, ethnic, religious, or social group. And so that's kind of like, that's a foundational definition, right? So when you see something like that, you see so many moving parts because it looks so different in every single person. And so how do we get an organized structure to be able to facilitate services to meet the needs of so many people who may have variations of all of this as the way culture is defined? So one of the things I want to bring up, and just so I can expand a little bit on what the title of this portion is. So we've all heard all kinds of cultural terms. What's the terms that you folks are used to? I heard somebody say cultural competence. What are you folks used to? Anything else? Any other culturally related term? Look at these. So any of these familiar to you? we have cultural knowledge, awareness, cultural encounters, cultural sensitivity. Of course, we have cultural competence in there. Memunatu?
Yes, I think cultural, they say cultural sensitivity
Okay.
and
so-
competence, or you have the
You what?
cultural sensitivity, being
Okay.
sensitive to the needs of the populations that you serve or their ways and lifestyles.
Okay. Culture sensitivity, and when we think about it, now, one of the oldest resources on culture and cultural competence, which used to be the term that was always referenced back in the day. Today we have a variety. So the National Center on Cultural Competence out of Georgetown has always had a continuum of different stages where a person or an organization or community can be in terms of culture, whether it's cultural destruction to all the way to cultural proficiency, and between cultural competence, cultural sensitivity. It actually kind of speaks to different levels where someone is aware, aware of the diversity. But it also speaks to whether or not they're responsive to it. And so with all of these may be appropriate and these may be the ones that you use. I wanted to bring up to what we're talking about here. So I wanted to just speak on the cultural responsiveness. When I think about the other cultural terms, and especially cultural competence, there has been such a controversy the last few years about not using the term. The Center for the Office of Minority Health still uses cultural competence. SAMHSA still uses culture. It actually uses cultural competence and cultural responsiveness. And so many different places are still using all kinds of terms. For our purposes here, I want to talk about cultural responsiveness, because it's really about how do we connect and integrate the community perspectives into meeting their needs. It's how we respond to them. So I think that is an appropriate term to consider. And so what it speaks to is services. Culturally responsive services are those that are respectful and relevant to the beliefs and practices and the cultural linguistic needs of the different communities and populations. And that makes perfect sense. This is also a way to address the power relationships. It's not just with the community served, it's also within your organization. It's also within your environment. It's not just for agencies, it's not just for the individual professionals, it's for the agencies and the systemic issues that they have implemented, the operations, the organizational structure, and different practices with that. It is not just frontline staff. And so cultural responsiveness is a concept that we try to discuss and inform about. In that way, we could start to look at what do we do? How do our outcomes meet the needs of the community? And so you can call it a lot of different things. So I just wanted to introduce that one too. Memunatu, you still have your hand up. Do you want to add to this?
Sorry, I have to lower it. Let me lower it.
Oh, okay, no problem. And so when we think about DEI, diversity, equity, and inclusion, and responding to the culturally responding to diverse needs, so cultural competence for equity and inclusion requires more than just understanding the impact of social inequality. It's a lot more than just that. And so to be able to really tailor not just the approach from one counselor to one member of the community, but the services themselves, the way the services are provided. So it really incorporates identifying and identifying what are the inequities in your communities, and how do you make sure that the interventions or the programs that you have already have available, how are they meeting the needs? Are they tailored to meet the needs of those inequities within the communities in your catchment area? So it has to do with your environment, it has to do with the protocols or the policies in place. And so it's the idea of working to develop an atmosphere of inclusivity, right? And not just for the community served, but also for the organizational staff. And more on that in a minute. And so how do we do this? So a lot of folks know about cultural humility. A lot of folks know about cultural humility. Does anybody want to speak to it here? Just give you a chance. You know, there's no right or wrong answers here, right? I promise I won't tell anybody what you said or you didn't say. I promise.
Diana?
Go ahead, Desiree.
So basically, you said cultural humility?
Cultural humility. How do you define cultural humility for yourself?
Okay. This is a new term for me as well because you always used to say cultural awareness. But cultural humility, I believe, is acknowledging your own biases.
Okay. Yes, that is part of it. Thank you. Anyone else wants to add to that? Being open-minded and humble to others, the ability to understand and appreciate others' cultures. Okay. Memunatu, and then
Yes,
Samantha.
that you want to accept that other people too are equally as capable and knowledgeable as you are, and not just thinking maybe because you are educated and somebody is less educated that you know better than them. Being open to understanding that other people's views matter, and that maybe you don't know it all, and that other people to know some things you don't know. Being open-mindedness. Thank you.
Thank you for that. Here's the reality. Okay, are we, I'm going to get you in a second, Samantha. Are we not doing person-centered care here? Are we not trying to meet the needs of that client? So I can have all the experience, all the credentials, everything in the world. I am all that in a bag of chips. But yet, when it comes to that client's world, only she or he or they are the ones that know what their world looks like, what their capacity is, what their knowledge level, what their limitations are, and everything else that has to be incorporated for them to exist and be successful in their world, how they define it. So when we meet people where they're at, we use all of our expertise accordingly, and that's the important thing. Samantha?
Yeah, absolutely. I'd love to agree with all that. And basically just summarizing that in the way that I think about it is just a willingness to kind of decentralize your own culture. So being open-minded, but also not thinking of your culture or your way of life as the norm or as something that is kind of the default in a way. So I think that that is the first step to kind of taking your own experience and views and your own culture, but also being as open as possible to whoever you're communicating with or providing care for.
Yeah, thank you. And one of the ways that you would do that, and we encourage this, is like you haven't enlisted the information from the individual. We're always talking about the ORs here. And we're always talking about open-ended questions, communication skills, because it's about what we work with from the other person, that we elicit from the other person. So when it comes to cultural humility, some really fundamental ideas here is, first of all, it includes a continuous process of self-reflection. When Jasmine was talking about how she was looking at herself and she realized, that the situation could have gotten better. Most of us remember when we were in school, we were in trainings where we were encouraged to, because we're in this people field, that we should take time out every once in a while and kind of like just look at how we've been engaging, how we've been doing with our communities, just to see if there's anything that, we would do different or we can improve upon. We don't always have to work until we get that kind of feeling that we felt like something was not done, was left undone, or could have been done better. We don't have to wait till a situation arises. We can get into the habit of doing that. So part of that self-reflection is looking at that. And Desiree mentioned it also is about, you are less likely to be biased with an individual. You are less likely, I'm not saying impossible, but when you acknowledge your own values and your own belief systems and your own perspectives, own them, be who you are. I've never done a cultural proficiency, culturally informed, culturally responsive, or cultural related, any type of training, and ask folks to change their thinking when it comes to themselves. Be who you are, acknowledge who you are. So cognitively, the benefit of that, cognitively, when we are consciously acknowledging something about ourselves, we're so aware of it that it's less likely to be part of the lens that we look at a new person with. It's less likely to be part of that process. The other part of cultural humility is that we work from what the other individual, the individuals, their perspectives, their culture, their belief system, maybe their ideas of how they got into their situation, whatever they're trying to address. In order to do that, it requires that we elicit the information from them. So we should not be making assumptions. We really should work with what they tell us. And so based on that, you're able to use an other person orientation, which is cultural humility is based on that. It's based on the other person's perspectives, their beliefs. The only way to do this is to elicit the information. Can't assume that you know it for them. And even if you were just successful with another client who seemed to have very, very similar issues. The thing is also acknowledge your own capacity. Cultural humility doesn't mean that you don't know what you're doing. It doesn't mean that you have not been successful in what you know. It means that you use your skill sets and your knowledge accordingly, according to every person that you work with. That depending on what they need, depending on what they identify, depending on their perspective, depending on what their work looks like, and which direction they want, how they want to go, you use your skill sets and your knowledge and your expertise accordingly. That's how we become responsive to another person. So in order to use cultural humility, we have to look inside. We have to look inside ourselves and look at where we're at to be able to put ourselves in position to be more person available and more person-centered, other person-oriented. This concept of cultural humility is also what the CLAS Standards looks at or encourages with organizations, because the whole idea here is to be able to look into the organization, see, acknowledge what you're doing really well, and then let's look at areas where we might be able to improve upon. It's still the same concept of cultural humility, and it doesn't ever stop. Because we are in the people field, this is something that we should encourage ourselves to get into the habit of doing every once in a while. You know, if a red flag comes up, it's something to look at, please do. But even when it doesn't, take a step back every once in a while. Once a week, when you have to take care of yourself, when you have to relax, you can always think about, you know, how different things occurred during the week and how did it go well? Then good, you do more of it. You use that strategy some more. If it could have gone better, then you figure that out and you try to take that awareness with you going forward. Cultural humility requires all that, or rather encourages all that. And so that way the other person is really doing the leading. And so on a scale of 1 to 10, how familiar are you with CLAS standards? I already asked you, so I'm going to kind of bypass this question. Let's talk about the standards. They were developed by the Office of Minority Health, their, Department of Health and Human Services. And decades ago, when reports of disparities were like pretty phenomenal. And because of that, so the Office of Minority Health wanted to develop some strategies to help organizations understand, instead of taking out the guesswork for you folks, being able to give you some kind of outline of steps that you can look at to be able to kind of increase your efficacy with diverse communities. So they're intended to advance health equity and to improve the quality of care and help eliminate healthcare disparities. And we know that, marginalized communities have been existing with limited resources for a long time. And so conceptually, these benchmarks that we're going to talk about are for both the individual professional and the organization. And this is all to implement culturally and linguistically appropriate services. And so here, I'm going to ask, I would like you folks to kind of listen to why we are talking about CLAS standards in the first place. Clyde, would you mind playing this for us?
Hi, I'm a physician and I'm here to tell you that health disparities matter. African American men die on average 10 years earlier than white men in the city. Healthier.
I want to tell you a story of a community health center in North Carolina where they were trying to incorporate health literacy practices with their population. And they decided that they were going to ask their patients to explain to them how they were going to take their medicines. And they were astonished. They found that 9 out of 10 times they uncovered mistakes that the patients would have otherwise made had they not had a chance to confirm their understanding and correct it. So this is an incredibly important issue to address for safety as well as communication.
Cultural competence and language access matter. We've heard it all. The abusive husbands asked to interpret for their battered spouses and girlfriends. A young mother of a dying baby asked to tell her husband to interpret for her husband the baby's dying, and the husband who yells back, "You're lying, I don't believe you." A Haitian woman pregnant, treated at a hospital and released for dizzy spells, who then weeks later learns she had an abortion there without her knowledge or consent. And the kids asked to interpret everywhere. Tell your dad he has HIV. Tell your mom she has advanced ovarian cancer. Tell your auntie her fetus is dead in the womb. We've had cases, 2 cases of children as young as 3 being asked to interpret for their own pediatric encounters. An 11-year-old boy who was asked to interpret for his own mother and told her, "Please don't cry, Mama. They tell me I have cancer." If it isn't culturally and linguistically appropriate, it isn't healthcare.
Do you think language doesn't matter? Nelson Mandela says, if you talk to a man in a language he understands, that goes to his head. If you talk to him in his language, that goes to his heart. Ensuring those who come to us for help understand the care they are receiving is essential for their satisfaction and safety.
I once interpreted for this elderly lady who had been coming to her primary care physician with her grandson to be used as an interpreter. It turned out that the information the doctor was obtaining through me was so different from what he had been getting through the grandson that he felt he really didn't know this patient, although he had been seeing her for the past 20 years. So he decided to cancel the rest of his afternoon appointments to really get to know her patient through an interpreter.
A Chinese interpreter once told me this: when a non-English speaking patient comes to the hospital, everything is strange. The sights are strange, the sounds are strange, the smells are strange. The only familiar thing in this alien environment is the voice of the interpreter. And it is the voice of the interpreter that allows this patient to connect with the doctor and to actually receive the health care that he deserves.
We all need to work together to advance health equity at every point of contact.
Thank you, Clyde. So I wanted you to see that video and hear from other practitioners, other peers from across the country, the different situations that come up that sometimes we don't think about. Maybe it happens in our agencies and we haven't known about it, but these are different types of situations that really encourage the reason why CLAS standards is something to consider as an agency so you can evolve your services. You folks must be doing great work if you're in business. Okay, so let's just put that on the table. All we're looking to do is enhance what you're currently doing and what opportunities can help us do exactly that. So let me do this. Okay. So all of you received this, the CLAS standards handout. These are 15 actionable steps that the Office of Minority Health developed. There is one principal standard and there are 3 themes. And under that, there are different suggested actionable steps that organizations might and professionals might consider. And so the first one, and I want to just, and this one will be kind of quick because it's more of a mouthful. Matter of fact, Alexander, could you help me out with this? Could you read this, please? Read this out for the whole group.
Principal standard, provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs.
Thank you. It's a pretty comprehensive standard. This is really more of the goal that most agencies are looking to do. This is really what professionals are very invested in trying to meet and trying to reflect in their practices. It's all of these dynamics. Well, some of the things that we think about when it comes to that is before you can provide equitable quality services to diverse communication needs and all that of different communities, an assessment is requested. An assessment is warranted because who are your communities? There was a time where they used to say every 3 to 5 years, the demographics of the communities change. It has been more an annual thing for most agencies, for most areas. And that's anywhere in New York, New Jersey. It's just the communities may seem like they're staying the same. You see a lot of diversity in there. So an assessment for the organization is key. Understanding, what are the different practices and programs? How successful are they? What programs are addressing the community needs and are not as successful? So we want to be able to identify what are you doing well, because a lot of times the very strategies that of service provision that you're doing well can be applied to other areas that are not doing as well as they can be. And that's the idea with that. But you can't make change unless you know what's in there to change, or unless you know what you're working with. And so the idea is to look, cultural humility requires that we look within ourselves. So it's the same concept for an agency. We also want to look at what do the clients, what do the consumers, what does the community, what do they say about their interactions with our organizations, with the programs, with the professional themselves. And then there's another assessment in terms of being able to consider how do you move forward and enhance and build equity on top of what you're already doing. Then you want to look at yourself. How familiar are you with the communities in the area? Do you and you all have an assessment that if you have time during the break, I would encourage you to fill it out. It's very simple. Every once in a while, a self-assessment is helpful. There's two different assessments that I encourage. A self-assessment that has to do with our current knowledge of the communities we're serving right now in our catchment area right now. Even if you've been in an agency 5 years, your catchment area is likely to look different than what it was back then. And the other self-assessment I always encourage is a self-stress, very simple 5 questionnaire to understand where you're at, because where you're at also speaks to how you engage with your colleagues, with your leadership, with the communities that you serve. And so this assessment, the one for the communities that you're serving, how much you know. When was the last time you worked off an assessment and how much, who is in your community? That's important to consider. So in order to be able to facilitate or achieve any part of that principal standard, how could you be equitable if you don't know who you're working with? So who's there? So look, real simple. And so what is the application ideas here is, so assess your agency for their capacity to provide culturally supportive environment at various levels of organizational structure. What that means, not just frontline staff. Frontline staff traditionally has been the one who is diverse and who's been the one tasked with having all the skill sets and all the continuing education credits so they can have their certification, they can have their licenses, so they can be representative of the communities they're providing services. And that's fantastic. But that's not all of it. It should be the same trainings you're required to take, the same concepts that you are encouraged to practice in your interactions with your clients are the same ones that should be also incorporated in different levels of the operations. And so so we're thinking about using a cultural lens. This is what we're talking about as using a cultural lens on all areas of operations. Gather information on the characteristics of your communities. You don't have to do it yourself. There are sources out there that you can easily tap into, and you can see who's in your community on an annual basis. And if it starts to look different, then you can better prepare to address issues that start to present or that emerge. And so also understand, client feedback. Organizations can actually, in a very unintrusive way, something that doesn't overwhelm many people, you can actually facilitate confidential assessments with the communities that you serve, with the people who already have services, or some people in care, and do it in a confidential way where they don't feel like any repercussions of will come back at them, like they won't get more services, where their feedback can actually inform some of the areas of some of the issues that your organization may be having that you didn't know about until they present it. So if one person says one thing, it may be something to look at, but if you have 4 or 5 clients kind of speaking to the same thing, and it's not something that you as a professional in whatever capacity you're serving in your agency was able to see until they met, until you asked, then that gives you a lot of, it gives you a lot of input that you can move forward with. I also stress this importance when we think about workforce. I know I'm talking about the community, but I'm also thinking about staff. Do a confidential staff assessment. So confidential where in a way where you cannot track back to the person at all. And there's different ways of doing that, and be able to understand staff satisfaction of the workplace conditions, how satisfied they are. I can't tell you how much I've heard, how many people have had overwhelming caseloads and not sure how to address it with their supervisors. Can't tell you how many times, someone has had, we've had so many experiences with overdose loss and the impact of that on you as professionals. And then you move forward to still work with others. Are you getting support for that? So it's important to understand where your staff is, where your staff is at, so you understand how you can move forward and you can help support them. And so thinking about an affirming environment, we're always thinking about developing an atmosphere of trust, making it culturally appropriate and trauma informed. And so we want to think about, even before we first engage with someone, we want to have that atmosphere where someone can come into a space and feel safe. That is going to increase their likelihood that they will interact and be more forthcoming with whatever information you elicit from them, as opposed to letting you in on some things of them 90 days after you did your first assessment. And so a welcoming environment, think about the physical space. Can the staff reflect the community? What are the posters? Is your environment, it's cognitive and it's physical. The physical environment does the physical environment actually reflect the community, the different community cultures that you come across, that you provide services to? And then it's also about how you introduce yourself to someone. How do you initiate that first greeting? You only get that chance to do that just one time. And how you represent yourself, how you show yourself, how you introduce yourself is representative for a lot of people, is representative of what the agency is about. And so that's really important for you to, when you first engage someone and you're not sure, what kind of needs do you have to help them, help address them. But so how you engage someone, how you introduce yourself, many times we encourage about, a very approachable way of introducing yourself and using pronouns. If you are comfortable doing that, I think pronouns are really helpful. I tend to have them in my little box here because I also have friends who identify as non-binary and they don't use pronouns, but a lot of people do. The advantage of that, though, the benefit of that is letting anybody know that you don't make assumptions about them. So that could be nice in the tone of voice, and don't be afraid to smile. The question I would ask is, does the organization provide things like for support for staff? Like for instance, I'm thinking about a couple of different settings where I've worked in the past, and I know darn well we didn't even have a kitchen. And so I'm wondering, does staff even have a private space for themselves? I'm not talking about your office. I'm talking to you, is there a space for yourself? We do make space for our clients. Is there a space where staff can go? Because one of the things that's been very, very prevalent in the last few years, especially since the pandemic, is the psychological impact of the workload, the risk of compassion fatigue, the risk of burnout, and the risk of traumatic loss. And so all of that requires support from the agency, not just the things that you could do on your own. So that's just an example of a potential way you can be supported. And here's some organizational assessment tools. And that's the overall standard. That's the overall standard, and that's what we'll start off with. Okay. I know I gave you a lot right there. Any comments, any questions? I'm going to give you a lot more. So anybody want to take a 15-minute break and go get some caffeine and some energy? There you go. Okay. All right. Don't log off. Let's take a 15-minute break right now. And we'll come back at 11:45. Okay, Eastern time. I just want to end this last part with this. And so when we're thinking about organizational tools, these at least are some of them. The Office of Minority Health and they do have a lot of resources there. They're the ones who actually developed the CLAS standards. We're just able to present it to you in a way where it can show the feasibility of implementation. And so these are some tools that you might want to consider. There are others, but these are really good ones. And so there's resources for each component that we'll speak on. So the first theme is about governance, leadership, and workforce. And some of this I'm going to take more time in, and some of this I'm going to kind of breeze through a little faster. This is really this topic warrants a whole full day of energy invested in this to do this appropriately, but at least this kind of gives you a taste of whether or not you want to explore this further. And so when we're thinking about governance, leadership, and workforce, kind of building on what I said before, it's not just frontline staff. The idea of cultural responsiveness or cultural competence, whatever term is most appropriate for you. You know, which for so long, many people or many organizations kind of saw it like something we have to do because we have diverse clients. It makes sense, but many programs, many of you, when you get funded for some kind of new service, you have a protocol how you roll it out, you know, and how the staff is going to do it and all that. Many agencies are so used to rolling out their programs that way that they almost see culturally responsiveness or culturally appropriate services to roll it out the same way. And this is where I'm going to encourage everyone to think of it a little differently. Everything that gets done in your agency should be through that cultural lens. Shouldn't be an add-on, should never be an add-on. It's not an extra service or program. It is a practice that is supposed to enhance every service and program that is provided. So not just the professional, but the organization. And that's why it's applicable on all levels. So with governance, leadership, and workforce, the suggestions that the experts are saying is to sustain and advance organizational governance and leadership, promote the class through active policies, practices, and allocated resources. That means HR, that means board members, that means your leadership, not just frontline staff. And so recruit and promote and support a culturally, linguistically diverse governance, leadership, and workforce. And so a lot of times, do we do our due diligence to, when we have positions open in leadership positions or executive positions, are we doing our due diligence to be able to promote and recruit, not just from within and given those opportunities, but also where do we go? Do we just go to LinkedIn, or do we go to other, or do we ensure that we are trying to have a broad scope where we provide these opportunities, in different communities that can be interested, so we can have representation, a diverse representation. So what is suggested here is to also educate and train governance, leadership, and workforce in culturally and linguistically appropriate policy practices on an ongoing basis. You folks are required to take a culturally informed type. I think about 6 hours for KSACs and social workers. I think about 6 hours or so to be able to do this within every 3 years. Well, even if the board member is not required, even if your executive directors are not required, even your HR folks, it really would speak for everybody to be kind of having the same philosophy, same thinking when they are doing their work in their capacity, to have that culturally informed lens. So everyone should be actually attending these trainings. And so they can be reminded. We can get very conditioned with any communities that we work with. And so being reminded of some fundamentals is really essential, not just for practice, but for the agency itself. So some of the things is to promote the health equity and use a class approach. And this is they're suggesting that because it already exists. You don't have to brainstorm how to do this. This is just 15 actionable steps, and the agency can consider which one of these or which combination of these might be feasible for you to include. You don't have, nobody's going to expect you to do all this. Organizational change is a lot of effort. It's a hell of a commitment and takes time. So which one is the most feasible? Which one is the most conducive for you? And so recruitment of culturally and linguistically competent leadership of workforce, training and education on all levels, engage in DEI specific trainings and brainstorming opportunities. So every once in a while, I know we have staff meetings, but every once in a while, why not include on the agenda different voices from different levels, and to see, how the environment is working, what opportunities might come up. Is there an idea that something you saw in another agency, or you see an emerging issue within the community, and you're not sure how your organization is working towards it? Maybe we should be in a better position. How can we prepare for it? So brainstorm everyone. So kind of just do a check-in. That can be very helpful. Here I put the implementation checklist because you can use that to write down any ideas that kind of come up or anything that stands out for you. So at least you keep it noted somewhere. That's one of your handouts. So one way that agencies promote their services, and this, I'm going to go through this a little quick, but one of the ways they promote their services is through their mission statement. Can everybody here, let me just stop sharing for a moment. Does everybody here know their organization mission statement? Okay, cool. So what does the mission statement do? What's its goal? What does it say? What's it for? Where do you even look? Okay. All right, so I see some. Thank you, Vietnam. Memunatu also, the services you deliver to roadmap help the poor and underprivileged. I'm not sure how it helps the poor and underprivileged, but I do know that it's an informational opportunity. Kind of a way for your agencies to kind of advertise what you do. Isn't that true? Right? So it usually has, so it usually reflects what you do and how you do it. Here's the interesting thing. If you have diverse communities, and you can be extremely eloquent in your mission statement, but if you have diverse communities, how would a member of a diverse, from a diverse background understand that an eloquently put together mission statement that does not necessarily speak to who they are, their identity, their community, how do they know that those services will fit them? So mission statements tend to be missed opportunities for some agencies when we don't include the culturally informed approaches that we use to reflect that we are more diverse in how we deliver our services. We deliver great services, but there's the person from Guyana who just got here, first generation, and just got here and say a few months ago, and these are services which he knows to come to our agency if he were to see your mission statement. And for some folks who do use technology and do research and who does what services and where to go, your mission statement can say a lot, but it can also say a lot of what you don't do, and you can miss those opportunities. So think about how we can consider that. So what does your agency? They're usually short, a short paragraph, a little synopsis of what the company's goal is or the agency's goal is, and it highlights the specific things that you do. And as I'm telling you, I've read some amazingly worded mission statements, but I often was missing the cultural piece. So how would that lady who doesn't speak English, only Spanish, and she's like 70 years old, she's now living on by herself, how would she know that you can give her support? How would the lady who, the older gentleman who speaks Mandarin, who has certain health issues, how would he know that you are able to be culturally responsive to his needs? And so this is what I'm saying. So Diane, go ahead.
Yes, the mission statement would be side by side in different languages. It would be
okay.
You have it in English and in Mandarin and in Spanish and the languages of the community that you're serving.
Oh, that's nice. I didn't know that. Is yours is like that in different languages?
Mm-hmm.
Oh, nice. Very good. That's a great approach. That's wonderful. That's one way of reflecting the diversity that you're recognizing in the community. That's great. So it's really speaking to an opportunity of letting folks know. It can tell the communities what your agency is doing. It could also tell the communities what you don't do. That's the downside.
Excuse me, Diana, can I read you our mission statement?
Yeah, sure. Go ahead.
Okay, this is a methadone program, SATP1 Montefiore. So it says our mission is to improve the psychological and physical health of people dependent on opiates. We do this by providing direct services to our patients, their families, and significant others, by educating addicted persons, health professionals, the community at large, by influencing policymaking and the clinical practice through research and program innovation.
And your question is, you want my opinion, or
no? Yeah,
your peers? I think it's very comprehensive of what you do. My only thing that I find missing there is it would other patients, if I needed your services, would other patients look like me? How would I know that? My comfortability in accessing your services in the first place might depend on that. So would communities see other community members like themselves? And that's what I'm saying is you folks have great mission statements. Can different diverse persons see themselves in that mission statement? And so, and doesn't take a revamp, a whole re-edit, a whole new essay or another. It could take 1 or 2 words. It's just, this is just one example of how, when we look at how organizations actually reach out to the communities, we can reflect that we acknowledge and recognize what the diversity of the communities, and we can actually speak to that within our mission statement. It's just one of many ways. And that's why I use that as an example. Something to think about. So let me go into theme 2. Any comments, any questions about that? So in the governance and leadership, we're trying to encourage that all the things that we always ask the staff, the frontline staff, to engage in, and the things that they're required to do to keep the credentials, we're asking that those activities also be engaged in at other levels too. So I read a lot of surveys and research outcomes and all that, because that helps inform, what I tend to present with you. And so one of the things, there was a Gallup study that looked at how many agencies actually do different types of DEI efforts with their organizations, and including the trainings. Trainings for frontline staff is mandated in a lot of agencies, in a good 85% plus, but less than 50% mandated or required that anybody else, executive leadership or any management or anybody else, any organization, go to it. So it's, they may or may not, they can, but they're not mandated. So that means you have different philosophies working out. One, and the executive leadership or the other HR or other members of the organizations don't necessarily have that aspect of that lens the way frontline staff would. And imagine if you all had it, the environment that you would have, you'd all be mostly on the same page, thinking about how this impacts the service provision, how it impacts how you submit for a grant. It would impact how you would do hiring. It would impact not just frontline staff and how you engage the community, but how we engage each other, how we develop an atmosphere where all staff are valued and are supported. And so just imagine how that can trickle into everything that everybody does, and collectively it would be an amazing impact. But not everybody's doing that, but it's something to consider. So let's talk about communication and language. And I want you to listen to something I am going to play. And let me know if you recognize what is being said. Okay, and I don't want you to say anything until I ask you a question about it afterwards. Okay.
Tengo un problema y necesito información. Me gustaría hablar con alguien, pero no puedo hablar inglés muy bien. ¿Quién puede ayudarme? Levanten la mano, por favor, si pueden ayudar.
All right. Who understood that? Okay. Let's try it again. Leslie, you understood that. Okay. All right. Let's try this again.
Niko na shida na nahitaji taarifa fulani. Ningependa kuongea na mtu na sipendi kuongea Kiingereza. Je, ni watu wangapi hapa wanaweza kunisaidia? Inua mkono.
Raise your hand if you understood that. Okay. So if you don't understand that, and someone comes in, and so the first language was what?
Spanish. Spanish.
Very good. Okay. So we know that. All right. The second language was?
Yoruba.
Fulani.
Urdu. I think it's kind of close in proximity in terms of geographical, but it was Swahili.
Yeah, Swahili.
Right? And so here's the thing. What do we do when someone comes in and asks a question or inquires about services because they need help and we don't understand what language they're talking? So, and that's what the statements were saying. The statements were the same. And what they were asking for is like, they're not comfortable speaking in English, but they are looking for, to ask some questions. Can anybody help me? But what if we can't speak their language? Then we can't provide services? Well, let's see. There's things that we can do. We don't want anybody to ever walk out not feeling like they were not addressed and they were not heard. And so communication and language assistance, this theme with the class standards warrants that we offer language assistance to individuals who have limited English proficiency and other communication at no cost to them. And so many of you do know and have the communication assistance services, where you could use over the phone, or instead of using more informal practices, the agencies are, I think federal funding actually requires that agencies have that available. And so part of that is helping your providers understand how to use them. So inform all individuals of the availability of language assistance services. Let folks know that they can ask them a preferred language, and we're supposed to be asking about that. I see you, Diane. We're supposed to be asking preferred language, and we're supposed to be letting them know, do they prefer to continue in their preferred language, or would they like a different language? Because then we can provide them an interpreter at no cost to them. How often do we get the opportunity to literally say that to someone? Go ahead, Diane.
No, my question was in the second one that you presented, I did not know what language that was. How do you ask them what language it is without being insulting? How do you get there?
Okay, I'm going to get there in a minute, and then maybe someone else has a suggestion before I get there.
So in our office, we use a signage, and once you get to the door, from that signage, you are able to identify like what language you speak. So that would have helped in this situation like that.
That's right. And a lot of hospital settings use it. I have a picture of it I'm going to show you. And so when you don't even recognize the language, you can have that in, say, an entry point. When somebody first comes in, they're speaking a language, nobody's familiar with them. They typically, they go through other receptionists, security guard, or somebody else before they see you folks. And so in order to be able to communicate and give them the right source or match, send it to the right person, you have to identify what's their language, and you have that sheet. Let me just pull it up right now. I just go back to it. This is what Biram is speaking to. This language identification tool, most states have their own version of this. And what you see is that in different languages are spelled out in English, but then you can also see the lettering in their in that initial that language themselves. A person can actually point to it, recognize that language, and then that indicates to the individuals asking them, who's actually has the identification tool with them, to be able to access the appropriate language assistance service to be able to communicate with that person. So nobody has to leave without speaking to someone, and so the idea here is how to bridge the gaps to communication with a lot of folks. So that's one way. That's one way, Mina. And thank you, Mina. And so what I'm thinking here are the suggestions that the experts tell us. So also ensure that professionals, your providers, are competent in understanding how to use language assistance services. Sometimes you do recognize, or you find that someone confirms a different language that you're not proficient in or you're not familiar with at all. And then so how do you access the services? What are the protocols? What are the procedures that someone has to engage in? There are times where in the agencies, I work with folks who have been in agencies where it's been years since they use a language assistance service, and then by the time they do need it, they're not sure how to do it. So why not consider maybe periodic orientation on these things, on these different services that are available for providers? And so it's really important to recognize that untrained individuals and minors should never be interpreters. You know, there's a lot, and you saw that video, and you heard what a lot of these folks, these other professionals have experienced. You know, we are ethically responsible to be transparent and clear with our information giving. And so we have to, it's our responsibility, not a family member or a child who may not necessarily translate exactly what we want to say. It's not their responsibility to do it. We have to ensure it. That's why we have language assistance services. The other thing is to provide easy to understand print and multimedia materials like signage and languages commonly used by the population in the service area. Again, it kind of goes back to the assessment. And the first component where, in the first principle where we looked at how do you provide services that are responsive to communities? Well, first identify what communities you have. With that, you want to identify the languages that they speak. And so I am going to ask you all, I'm going to put you in a breakout group. And so I'm going to ask Clyde to kind of coordinate this so we can have groups of 5 persons each. I'm going to give you 15 minutes. All right. And so what I'd like you to do in terms of language, in terms of community, and in terms of your current knowledge, kind of figure that you're all working in one agency. Think about that. Now, you're gonna, and your agency is about to roll out this new program. It has food pantry service. You know, it does offer, you know, and it's also, you're also going to capitalize on the opportunity to be able to offer depression screening when, you know, when they're registered, you can ask them, you know, you can offer that. But what you're really doing is providing a food pantry service, right? Now, what if you had to create a flyer to promote this? They tasked you and a couple of peers to be able to come up with some flyer that would be conducive for communicating to the communities that this new service is available. So what is it that you have to consider in terms of making this flyer? And so think about whether your communities is Indigenous people, think of, is it the Latinx community? Is it the Black community? Is it Asian community? This, as a group, decide what community you're going to work with, and who you're going to make create a flyer for. And in creating a flyer, what are the language and communication specific issues that you might have to consider in order to promote this new program? Does that make sense for everybody? Okay, choose your community and then think about how you're going to promote this new food pantry program. In order to communicate, because it's not just the idiom, it's not just the language, but how, in order to communicate so folks can understand that this is available for them, what things can you consider to be able to promote this program? So I want you to go into your groups for 15 minutes. And all right, my silent partner is ready. What I want you to do is just click. I'm going to put this in the chat. I don't know if you can see it, but just keep in mind that you're going to choose a community, one of the 4, Indigenous people, Black, Hispanic, or Asian community, and then think about promoting a food pantry service to that community. What do you have to consider in terms of communicating, like on the flyer? Come up with like at least 3 points, okay? So, okay, Clyde, we're ready. I see smiles. Hi, Miriam. I see yours. I see a lot of other smiles. Did you come up with some fantastic ideas?
Yeah, that was a good meeting.
Awesome. Okay, so here's what I want to ask, and this is just in general because it has a lot of folks here. I want to ask you, what did you learn from doing this activity? And I'm not saying about the specifics about that particular group, or maybe I am asking that. What did you learn from actually having to do this?
Coming together as a group to coordinate services.
Okay. Well, it's great when it's a meeting of the minds, isn't it? When you're in a group and everybody, that's great. Thank you, Daniel. What else?
We brainstormed. We were like, what would work, what might not work, and we just brainstormed and got up and just came to a conclusion.
And isn't that interesting that you say that? Because I always think about, you know, what voices are not necessarily included when these new grants are being, you know, are being written up for, or being applied for, or being facilitated, you know, being rolled out.
Right.
Okay. What else?
I I had an idea.
Okay.
I experienced all that goes into it. I mean, we thought about what type of foods would we have? How would we market it? How would we, express the language, and who would we include? There was so much to think about.
Very good. Very good. Thank you. Mamunatu, go ahead.
Yeah, we were in group 5, and we thought of taking the Latino community or Hispanic, and then we'll make a very broad, big, colorful flyer. We will use pictures because not everybody can read or write. Some people may speak the language, but it doesn't mean they can read it. So we will use pictures to show what we do or why we are inviting them out. We'll send the flyers to the barber salons and shops and grocery stores to make it more accessible. We want to make it diverse. So even though we chose his Latino community, we also put some English in there, just in case somebody can read English, they'll read it. We are not going to require IDs so that we don't scare people from coming to receive the services. And then we want it to be very diverse, we already said. And we'll use ethnic foods like Melissa said. We'll put guava in the best, rice, beans. We'll make it very welcoming. And then Eunice, do you have anything else to add? Do you have something?
No, you did wonderful putting everything inside, because what we also learned was, although we was targeting the Latino, we wanted to be for everybody in the community, for the fact that, it's like you have other people coming in to visit, and it's a matter of, it's one for all. That's the way we looked at it. Everybody should be able to utilize it from the one picture. So and that's what I was saying, that's what this whole Zoom meeting was about. It was a referencing being able to be diverse and target everyone. So yeah, I loved it. It was so we had a great time. Yes, we did.
Well, we also had a great time in my group, Diane. What we pretty much came to the same conclusion that the other people came to, but we decided that there's going to be perishable and non-perishable foods. And we're going to have to consider that some people can't eat certain things. So we'll try to have a little bit of everything so that people will have a choice.
Very good. Thank you. I just wanted to mention one thing that was mentioned before. I like that if you were targeting the Latinx community, that you're not assuming that everybody speaks Spanish. A lot of communities do not speak their native tongue. Okay, acculturation plays a big part in things like that. Okay, so thank you for that. So very good. Just
a quick addition. We also said we are going to be flexible. We'll be serving migrant communities.
Yeah.
So sometimes they may not be able to come in, so we won't be 100% structured, come in 9 o'clock. We will be flexible and accommodate their schedule.
Right. It sounds like I gave you more than 50 minutes. That's great.
Yeah.
Okay. So right now, let me take some hands. Hold on. Let me take some hands. Lynn, go ahead.
I'm speaking on behalf of Group 3 with Donna and Lisa. And so some things that we had thought about that a lot of people have already addressed is what cultural foods the population and the demographic has. So we went with the Pacific Islanders. And Lisa was kind enough to look up some information about it in our quick 15 minutes. And she found that, some of their staples are plantains, bananas, coconuts. So as somebody else had stated, they had thought of putting pictures on their flyers or what, and whatnot. And then, we discussed a little bit about the cultural perspectives on accepting services for depression or, and food pantry services. And one of the ways that we had talked about discussing or addressing that through the flyer is actually meeting the people in person and talking to them to be able to kind of gauge where they're at. And then we also talked about, what agencies and services that we would need to engage in finding the sources for cultural foods. to bring to people. We discussed having something on our flyer, that lets people know in whatever the languages that they're speaking or languages, that we have a questionnaire that they can answer the questions for as far as what they would like to see in the food pantry or other things that they're interested in, as far as that.
Right.
And then having just, hors d'oeuvres or whatever in their foods, just to kind of, because, everybody loves a snacky. So
I think that's a great idea. That's what I think I find that slightly unique, is about getting their input. Listen, what do you think we should have here? And it's a new program. I think that's fantastic, along with all the other wonderful things that you folks came up with. Damn, I'm only 15 minutes. That's really well done. Thanks, Lynn. Desiree?
Okay, Diana, our group 2, we went in a different direction.
Okay.
We opened up a community center for the Black and Brown community. And on our flyer, we're going to offer services and let them know that we're going to offer mental health services as well as medical services. Like for mental would be depression screening and anxiety. Then we're going for medical, it would be for diabetes and blood pressure. So that's going to be on the flyer, mental health and medical services provided. On the second line, we're going to have Narcon trainings / groups and incentives for taking the training. So part of the incentives could be to provide, snacks and food if they attend the groups. And on the last line, we would have educational materials provided. And of course, all services would be confidential. And when we say the Black and Brown community, we know that it's not just English. So we would have an interpreter for the Haitian population, Panamanian, Nigerian, Spanish, and what else? And I think that's it. So we're going to address everyone in the community.
Fantastic. Ambitious. And I think I want to know when you're open positions, okay? And so, no, thank you. Let me just say something. So sometimes folks not sure mental health can be a little off-putting. You can also, think about it in the fires, like, you ever feel stressed? You ever feel like you need somebody to talk to? Like, kind of find another, also consider wording it in simple ways where somebody may not be hit with mental health, like you're doing that, but it presented a little less. Maybe for some folks, it could be, say for the older cohorts, one of the things that do happen with folks who don't work in your field is like they don't know a lot about mental health. Younger generations seem more likely, according to the research, to access services for mental health trauma, stress, and that kind of thing. And many times older folks who are not informed like you folks are tend to kind of shy away from that. And I'm thinking about a project I'm engaged in right now with the Black community, where we're using experts who engage members of church environment and to be able to help offer them depression and anxiety screening. And so sometimes how you frame it can also can also help with that. You just triggered that idea because it's something else I'm doing. So, but yeah, so thank you. Thank you so much. Kimberly, go ahead.
Yes, so I'm representing group 1. We selected because we wanted to challenge ourselves. Most of us in the group have not worked with anyone from the Asian and Indigenous people category. So we actually said that we did an assessment, narrowed it down to Chinatown in New York, and that we would, the assessment yielded that these were Chinese Americans who had been in the country for more than 5 years. So we kind of did that assessment. We arrived at providing advertisements that would be in English, Chinese, and Mandarin. We also talked a lot about how to get this information out into the community. So we talked about some of the values of that culture. The elderly and family are really important, as well as the local food markets, which is where we decided that we would place a lot of the flyers in terms of advertising the food pantry for families that have food insecurities. Some of the individuals that work in the market would possibly know through conversations, some of the families that could benefit from the food pantry, so they could offer them a flyer. We also talked about having some of the food markets donate possibly some of their foods to the food pantry. I think it was Melissa who was saying, generally some of the food pantries kind of have just staples. So they may not have some of the foods that the culture may necessarily use to prepare some of their meals. Oh, and we talked about also doing an open house, serving some of the fruits, vegetables, and kind of foods that are served at the market to bring some people in as well. And that the elderly could maybe also put together some of their recipes and share, some of their recipes related to, utilizing the items from the food pantry to make meals.
That's really fantastic work, everybody. I think it's such great, and it's very comprehensive. Isn't that interesting? And when you're promoting a new service or a new program or a new agency, like Desiree was doing and her group was doing, it becomes very comprehensive. So my question is this: when you're interacting with your folks on a one-on-one, do you tend to use that comprehensive lens for every given individual? And that's rhetorical. I'm not asking anybody to respond. I just want you to think about it. Because just how you thought about the details of as a community, when we engage with the individuals, all those dynamics also impact them as well. And that's just services that they even accessing or we're outreaching to. So, and that's why part of the reason, that's why I asked you to kind of engage in that, because it's kind of a really neat thing to really think about, oh, wait a minute, that's right, I don't think about this, I didn't think about that. Sometimes those things are the things that impact why somebody can't follow through an appointment that they tried so hard to get, or why they can't, or you lose them to care for some reason, you think it's you, it's not you, it's something else that's going on. So sometimes when we consider these, it can better put us in a better position to be prepared ahead of time, as opposed to in hindsight. So that's part of so conceptually, a lot of what you want to consider when you promote to the communities has a lot to do with knowing who the communities are, and then understanding the dynamics that impact them, both from an organizational level as well as an individual level. So really good job. I think you guys were really creative, and I thank you for that. I know we don't always get to think about that, and our jobs don't necessarily require it, but it's worth considering. Okay, so I'll give you guys a hand.
Room 8, if you don't mind my adding room 8.
Oh, go ahead, Thomas.
Okay, good afternoon, everybody. Okay, I don't want to repeat what others have said, but what stood out was that the language we are going to use in the flyer, that is keeping it simple and very specific to the services provided. The flyer has to be colorful so that it can be catchy to those people that will need to read it, and it should be accessible to all regardless of income. And other things consider was limiting it to daily limit of 35 people, so that we don't run out of food. So that when people, everyone that comes in, it should be on first come, first serve, and everyone should be able to get something to go home on the day they present themselves. Like others have said too, interpretation will be available for people that don't speak English, that is in Spanish, French, Creole. Those are the things that are distinct from other people presented before. Yeah.
That's right. Very good. They say that the top 3 languages in the nation is English, Spanish, and Portuguese, but it depends where you are, because if you go to a certain part of Brooklyn, some of the indigenous languages from Africa is what's being spoken. Thank you for bringing that up, Thomas. And so how do we find that out? Assessment. We look at the community before we even roll this out. So that's really neat. You also, what else? And there's one or two other groups that didn't report out. Do you wanna share it here?
Can I jump in? And yeah, I was with group number 4. Everybody else was
Okay.
with group 2. Okay. We kind of we were looking at the Black and African American community, and I guess a level of trust came into play where we were not going to require them to show us their IDs. We were giving away this food, and we wanted to give away the food, and we didn't want to hinder. So we said we would just ask for a name and a phone number. For phone number 4, if we decided we're able to do it again, we would reach out to them. We also asked if they had that an email address was optional because we were considering our seniors, and most seniors don't have access to an email address. And we wanted to also offer them information about community resources that are available. We're going to invite our community partners to come in and be there with us on that day, so that they could, while they're waiting to get their food, they could be talking to somebody to find out about housing, to find out about health, to find out about what's available in the community. And what else? There was one other thing. Oh, we were emphasizing that the food was free and that it was going to be there as long as it lasted until we ran out. So first come, first serve, and that was important. We felt that was important.
Yeah, I know you'd have to, and I know Thomas spoke to make sure everybody gets some food. You're gonna have to be, depending on your funding, you would have to be strategic about that, you know, and kind of work out a screening process and how you're gonna be able to do that, you know. But yeah, I love the sentiment. I love how you really try. I really appreciate you added something. Everybody's been adding something unique that someone else that another group hasn't mentioned. In your group, it seems like you wanted to take a collaborative effort. You know, other ancillary partners in you can be on site while you roll out and promote your services. I thought that was very nice, very helpful, you know, because that way the community members kind of you can build a lot of credibility and trust with community members that way. You know, I thought that was a very neat suggestion. So Malaika, did I say it right? Malaika?
It's actually Malaika is the correct pronunciation, but my mom says Malaika. So
what do you prefer?
Either one works. I don't mind.
Oh, yeah. Okay.
Yeah.
Malaika.
So a lot of what we said was already said. Inclusive imaging. We picked the African American community, but we weren't going to use African American pictures. We were going to use pictures that use maybe primary colors to denote people, so that it didn't focus on race so much, so that it was open to everyone, because in the African American community, everyone is not one color.
Right.
So non-judgmental language, we wanted to get away from free and, you know, handout kind of language. So this is what is available. You can come, you know, we wanted to make it inclusive. The African American community sometimes is prideful, and we didn't want them to feel like, you know, they didn't want to come because it was a handout or whatever. So we wanted to get away from that language and make it non-judgmental language. Fresh fruits and vegetables. We realized that, you know, a lot of African American or people of color are not indigenous to America. They come from countries and places, even down south, where fresh fruits and vegetables is a norm. So we kind of wanted to focus on a lot of pictures of fresh fruits and vegetables. We wanted to get away from a lot of words because people, again, can't, you know, we're not sure what educational levels. We wanted to make it available to everyone. So we would incorporate a lot more pictures and more languages. So in our group, we said Spanish, French, and English, which are a lot of, you know, primary languages for people of color in community. I believe that encapsulates most of what we came up with. We didn't know that in a perfect world you can choose the fruit, the food you get at a pantry, but I know at our pantry we get what we get. So we kind of, you know, we kind of make it as inviting as possible. But what I do like about the pantry that, you know, I participate in, we do get a lot of fruits and vegetables, fresh fruits and vegetables, which is important. We're a primarily Hispanic community, and they really appreciate the fresh fruits and vegetables.
Yeah, especially in communities or neighborhoods where fresh produce is not necessarily.
Yeah, we talk
readily
about food
accessible.
deserts. Yeah.
Yeah, very good. Was there someone else that wanted to say something? Nice work, Malika, you and your group.
Thank you.
All right. So very good job, everybody. I think it's fantastic. And what I wanted to kind of go piggyback on is the culture humility concept, that what we are asking ourselves, what we do and what we're encouraged to do as professionals, the same thing the organization should can be doing. And the same thing the organization does. It's the same concepts that you can apply within your individual practices. When we do get caught up in our routines and with providing services, and I've got to kind of think a little bit outside the box and think about other dynamics that might be specific to that culture and that person, and other reasons and things that we don't necessarily ask about. Maybe consider learning how to developing questions so you can ask about things that might impact somebody's ability to come to an appointment at a certain time. You know, when does somebody pray? There's a certain prayer hour for Muslims. There's other organizations that also, or other communities that also like to pray, and they engage in certain practices at certain times of the day. Or certain days of the week, you're not going to see them. It's not going to happen. You know, that kind of thing. Understanding how important that is. You know, and that it takes a little bit more thinking. We don't want to generalize anybody. And this is all about tailoring services. So that's what the CLAS standards is helping us understand, that how we can look at different things that we're doing, how we can look at the community, understand that we have to identify that first, preferred languages, emerging issues coming out, cultural issues that may impact their decision-making process, how they live, what they will do, and you to incorporate that. And so you can enhance what you're already doing. So really, really good work, everybody. So I just wanted to go over just a couple more things here. What, you know, part of what you did right now is it's what the suggestion is, to conduct annual assessments of the communities, of the languages. You know, are there folks who have certain disabilities, you know, deaf or hard of hearing? Language access and language interpretation. One of the things I mentioned earlier is that not everybody who identifies Hispanic, Latino, Latinx actually speaks Spanish. You know, and there's also not only that, any language that you're speaking about, it's not just English, but all the other languages that we need to incorporate, depending on your community, also a comprehension part of it. That's why it says language and communication, because other aspects of that exist. And so understand what, kind of look to inform how you move forward. And so also the records and patient education and promotional resources can be translated according to the languages that you identify in the community, including audios or Braille. Those are opportunities or approaches to promoting services. And what I read in the research is to not make assumptions about anybody's level of proficiency with reading. And so 6th to 7th grade level literature, language literature is probably easy enough for everybody to understand. And so that's something to consider, you know. A lot of times you can get the information, the community assessments from your grant funders, because they're the ones who are funding you to do a lot of the work in the communities that you are funded to do it in. And so if that or the state, like Office of Mental Health, the Department of Health and Human Services, they have very area specific data sets that you can tap into, so you don't have to kind of brainstorm how you're going to get the information from the community. And so in terms of that last one, language and communication resources, I gave you some more resources. And so I just want to briefly speak to this because I want to end on a couple of other slides. This third component of CLAS, engagement, continuous improvement, and accountability. Anything that the agency and everybody who is invested in implementing a new change and to try to go forward to build equity in a particular area somewhere in your organization. You want to be able to assess the community, assess your organization, see what you're doing, what's working well and what isn't working well. All those assessment also speaks to, understanding what you start with and also look at what efforts you're going to invest in. You want to monitor those investments. You want to monitor that and monitor that energy that's being invested, those efforts. Are they working appropriately the way you projected they would be? So there are opportunities to do that. And we have some suggestions here and how the CLAS standards can actually help suggest some ongoing assessments and how you can maintain accurate data on demographics of the community. And so periodic assessments, I always suggest an annual assessment of some from a credible source that you can just access on a regular basis. And let your organization know, let your staff know that your agency is invested on doing this and that their input is important, because it shows staff that the agency actually cares about staff wellness as well. That it's not just about business and giving services to the communities. That's the major focus, but we want to take care of our staff too, and say and let them know how valued they are. And so you have different suggestions for applications here. You also want to put in protocols in place that would allow for the community and staff members to provide ideas, suggestions, and review them. It's not enough to hear the voice of staff, it's not enough to hear the voices of the community. It's to be able to, inclusion means that we consider those suggestions and integrate them wherever possible if it's going to enhance our service provision. And these are some more examples. What I want to end with is this: a cultural respect really has to do with, for the provider, the healthcare, that elements that influence, understand what are the elements that do influence belief systems, decision-making, wellness for different people. Because the concept of cultural respect has a positive effect on the delivery of care. It has a positive effect on you when you're supported. So imagine when you are reflecting that with your clients, they're more likely to adhere to their own wellness process. It's the same thing for organizations. Even if it's not a moral motivation, the folks who outdo their peers, outperform their peers, are those organizations that actually include inclusivity and diversity in their setting. And so here we add the B. So diversity is the presence of differences, the representations of genders and cultural perspectives and religious outcome and religious belief systems and more. And yes, equity is the process of fairness. What's fair for this person may look different for the next person, but we want fair access to resources and opportunities. And inclusion is the outcome to ensure that all those from diverse backgrounds feel valued and are welcomed. And that is, these concepts are for both the staff organization to develop that cultural workplace environment, that atmosphere. And also the last thing is the belonging. So it's important that you folks feel like you're leveraged, feel like you're valued, feel like you are highly regarded for what you bring to the table, what you bring to your job every day. It's important that you feel like you like to go into work. That translates in what you do and with the clients. It translates in how you engage with your other peers. And it's to the organization's benefit to make sure that they are supporting your wellness. And so that's in a variety of different ways. You got other trainings also that can tell you about, how to deal with grief and loss, organizations can do to support you. But the idea is that you are important too. Our focus is always the client. Guess what? Your focus, your wellness is also important. Because if you're not well, if you're not grounded, if you're not supported, how can you support other folks? So it's to the benefit of the leadership to be mindful of that. So use the racial equity framework. And so really a lens is really it's really the opportunity when we ask ourselves, do our policies and our protocols actually reflect the values of cultural responsiveness and valuing people for who they are and what they bring. And so it helps us assess whether we're taking those perspectives and, for racial and gender diverse people into account. Are we integrating them? Are we practicing these concepts within our own organizations, with our own staff, with each other, with our colleagues? And so the benefits include that when people, especially staff, feel valued, you're more engaged, you're more motivated. And you don't mind that Monday comes around as much. You don't mind going into office because you like your job. Imagine somebody, and everybody probably knows somebody who at one time or another had to go into a job that they really didn't like, that they felt undervalued, overworked, underpaid. These are the things that really helps create the atmosphere. 31% are less voluntary turnover in organizations that actually include, conscious and intentional efforts on DEIB, on diversity, equity, inclusion, and belonging. 12% more likely to have strong program outcomes. And these are the folks who are happy to come into work. And so with that, I just want to say thank you all for your participation, because I have to give you time to do a giver. And so I'm not going to ask you if there's any more questions right now, but I really appreciate your participation. And so from that perspective, you're going to have these slides. And so you have them, you have the cited sources, and that's for your own further information. By the way, Building Health Equity and Inclusion, this is a site, free resources. Man, it could be very informative. You can use this in-house with your staff. Check them out. They're really well developed informational webinars and such.